Today is February 21st, 2021. It's been about 3 weeks since my last hair restoration session. So today, as usual, I'm going to talk a little bit about where I am right now, how my hair is looking. But I don't want to spend a lot of time on that because a couple other things have actually been on my mind that I'd like to talk about. And one is the use of medicine, finasteride, minoxidil, and other treatments, and my personal experience and some updates on that. And the other topic I'd like to spend some time on is hairlines. Hairline designs, and when I say hairline, I'm also talking about the temple area. This is the cornerstone of any good hair transplant. The whole head is important, but nothing is important as the hairline. I've heard all kinds of terms before, like framing the face and angles and different things, and I've seen some great discussions about it. However, there is some additional thinking and my own personal take on it that I think hasn't really been covered. Without further ado, let's look at my hair right now, but I want to prepare you. At first, it looks like I've had a setback because I am experiencing a lot of shock loss right now. Sure, that's also called telogen effluvium. That can happen for numerous reasons, but I believe right now it's happening to me because when I had my most recent hair transplant, it covered, though it wasn't super dense, there was a lot of poking all over my head, and I am very susceptible to shock loss. So basically, it looks like I have less hair than before my hair transplant. The other thing is I've been taking finasteride for about 3.5 weeks, and that's pretty early in the game, but that definitely can cause some of the miniaturized hair to fall out. There definitely are some spots, they look bald again, but I'm fully confident, as has happened in the past, that that's going to come back and that's going to be fine. And I certainly don't like this, going through this shock loss, but am I worried about it? No, not at all. If 3 or 4 more months pass and it still looked like this, then I'd be like, oh man, something's wrong. But I don't think anything is wrong, but let's take a look. First, so you see here the hairline, and that is not that affected because that area wasn't really transplanted. But you see here, there's like this kind of recessed area. Some people call that a mature hairline. That's something I'm going to be talking about, and that's something I want to address. Okay, let's take a look at the side. And you can see I have somewhat of a mothball eaten look just from the amount of FUE I've had. And at one point I'll probably have SMP, that's the scalp micropigmentation, the little tattooing. I'll probably have some of that to fill it in. Okay, let's try to do the back here. So this is just a straight back, and I'll include some photos too if this isn't coming out. But I think some of the hair is actually starting to come in. I've been worried about that because I mentioned that you might not be able to hear me. I mentioned that I put hydrogen peroxide there, but I think some of that is recovering. Maybe the finasteride will help it some. And let's look at the vertex. I'll have to probably do a different angle. This is where the most shock loss is evident. So this area right here, before I had the transplant, it was thin, but now it is more thin. Again, I had it here on the sides too. I had some in this most back area, and this will probably require photos. So this area is definitely very thinned out. I took some video shortly after my transplant when all the scabs were out and before the shock loss, and it looks great. And obviously I hope all that hair comes back and it looks like that again. So after this introduction, I will be showing you that. So I'm going to take this out of the tripod and do a couple more shots of my hair, and then we'll get into some of the things I want to discuss about the medicine and primarily about hairlines, hairline designs, and my thoughts about that. Okay, here I am in more of my usual spot. And again, here's this hairline. And let's try to go over the top here. And again, this area is quite thin. This middle area is more thin than before. Basically, it looks bald now. And here's this back area. And you see, I think I am making a little bit of a comeback. This area still looks quite thin. I'm probably going to need to have another transplant, but I do see a little bit of growth happening. So in a way, not much to report other than right now I've had what looks like a setback, but is a normal cycle of hair transplantation, loss, and growth. So not a lot to report on that right now. It's been 8 days since my transplant, and I believe at this time all the scabs, things like that, have come off of my head. So this is how it's going to look when the hair grows back. I believe at this time, very few, if any, of the hairs have fallen out. So this gives you an idea of what it's going to look like. Though, of course, in a couple weeks, everywhere that's been transplanted, that's going to fall out, and I'm going to have to wait around 3 months to see how it looks. So let's take a quick look. My wife is talking in the other room. You might be able to hear that, but hopefully not. Okay, let's take a quick look. Do my best. Go in the back. And you can see, as I mentioned before, this back is thin, but I think it actually might be starting to come in a little. And the doctor did that PRP, that's where they spin your blood around and get the platelets. She's been doing that every time, and she did notice it looked a little thinner, and she put some of the PRP right in that area. Difference. Also, I've been taking finasteride, guess about a week now. I'll give a bigger update on that. I want to give a brief update on my recent finasteride experience. I have tried finasteride a few times in the past. I recognize it's beneficial to block DHT, and I certainly want the benefits from that drug. But each time in the past, I had erectile dysfunction, Call of Duty would arise, and I could not stand to attention and fight the battle that needed to be fought. This time, I've been taking minoxidil 5 milligram for almost a year now. One side effect, in addition to body hair and some additional hair growth that is normal with minoxidil, is I have noted improved erections. That has been a pleasant side effect just with minoxidil. So I don't know if everybody who takes it has that side effect, but it got me thinking, okay, let's try finasteride again. So here's exactly what happened. About a month ago, I tried finasteride again. Now, sure enough, within a couple days, I started getting this erectile dysfunction again, and I was like, oh no, maybe my theory is wrong. I'm not going to take it. So then I was like, okay, I'm going to try Viagra with this. I tried that, and pop goes the weasel, and then there was no problem. But I don't know if I want to take Viagra every time necessary. That can be inconvenient. I mean, it's easy to buy here, but at least I knew, okay, I have a workaround if that happens. So tabled that, I was like, okay, if necessary, I can take this. So I kept with the finasteride, and then that side effect went away, the erectile dysfunction. I don't have any problem with libido or any other issue. I seem to have a little bit more insomnia. I'm not like the best sleeper, but that's tolerable. And every now and then I have what you might call a neurochemical moodiness, maybe a little bit of like depression. But I can recognize nothing is wrong in my life. This is just some weird chemical thing that's happening. So that too is tolerable. So synergistically, taking the minoxidil and the finasteride, for me, I have been able to overcome the side effect. And before I started taking the minoxidil, I did try again in the past year. And I had the side effect, and I just didn't stick with it. So it seems to me, in my situation, taking minoxidil 5 milligram, finasteride 1 milligram daily has allowed me to overcome the side effect. So now I'm taking finasteride every day. I've been taking it almost a month. I think I've had some shock loss from it, maybe, as I mentioned. And I know it's going to be a few months before I know if it's helping me or not, but I'm quite happy that I'm able to take it, and hopefully I get all the benefits other people see. So that's my update on finasteride. And you might want to try, like me, to do it under a doctor's guidance. Remember, I'm not a doctor. This is not medical advice, but under a doctor's guidance, you might want to try 5 milligram minoxidil and finasteride. But I would first try the minoxidil, and if you don't get the side effect I got with the improved erections, then there's no reason to think when you take a finasteride you're going to have that benefit. But if you do independently have that benefit, maybe you'll get lucky like I did, and you'll be able to take it if in the past you couldn't, if you had the side effects in the past. But let's get back to this hair. So let's see here. Oh yeah. So in the front, looking pretty good. Again, I might like to fill it in a little bit. Let's go over the top here. My hair might be slightly wet. I like to periodically use this tea tree oil. I don't just use it straight. I dilute it about 1/4 tea tree oil and then the rest water. And that can help with itching or any rashes or anything. And that type of thing I only would start at this point. It's already been 8 days just using that a little bit. And maybe I'll do another video also about the kind of pre and post-op transplant. So let's continue looking here. Okay, so here, over the top. That's good. Yeah, it's looking pretty good. I'm quite happy that amount that is filled in. Hopefully the finasteride will make that even more filled in. I've heard of different reports. Some people say they have gotten as much as 20% of, so let's say they had a hair transplant and then the final growth after a year, they'll say maybe 20% of that is from finasteride and then the rest is from the hair transplant. So if I could get another 20%, that would be good. So yeah, this area in the back, that's matching a lot better. I guess you can maybe see it barely tiny difference, but not really. And you know, mostly you're looking straight at people, but even like this, it's definitely way less pronounced. And those sides are looking filled in too. Quite happy with this. I'm hoping with the finasteride and maybe even a little SMP, I'm hoping I don't need any more, but if I do, I can do a little more also. So this is the next day, February 6, 2021, and now my hair is dry. Let's take a quick look. Here's this right side. Front looking pretty good. Left side. I notice in a lot of hair loss videos, well, as I said before, the length will be different, and particularly when the length is long and they've had temple transplantation, and then they'll do this kind of crazy combing where you can't really tell if they're just doing a semi-comb over or there really has been growth, and that can be annoying. So something I've tried to do in my video is keep it the same length and be quite honest and clear about what's looking good and what's not looking good. I think some people, I don't know, maybe they're in denial or they're embarrassed if the result isn't good. And some people, the result is good and it just isn't clear the way that they presented it. But I think that can be very important, apples to apples comparison. So my plan is I'm gonna maybe grow it out a little bit, but then I'm gonna keep shaving it 2 to 3 more months, because this newly transplanted hair is gonna fall out, and that difference is gonna be pronounced for at least a couple more months. But once that goes through its cycle and then starts to grow, then I'm gonna try to let everything grow and see how it looks, and that'll be interesting for everyone. That's it for now. So I just had a follow-up, 2-week follow-up at the doctor for my recent transplant, and we both agree I actually can do one more from my head. Let's take this off here. So just filling this in a little bit more. And then you see there's this temple point, there's actually a little tiny bit of recession. And this side, that side I don't have any temple point because I have a scar here and it's related to my head injury, but the nature of this scar, we kind of cut that off, so I need to kind of reconstruct that. That wasn't due to hair loss, that was from surgery. But anyway, so kind of fix this up, fill this a little bit, this little bit. She thinks all that can be done with 500 head hair grafts, but we'll see. If there's not enough or I need more, I can also take from the chest hair, but if that is possible, that would be quite nice. It's Chinese New Year here in Asia, so that's what's going on behind me, though I'm not sure who those guys are. But they all look like they have hair. Here we are at the M. Cordier Mall. There's a pretty nice view of Bangkok. This is Phrom Phong. Okay, back to hair loss discussion. When I first was losing my hair, it seemed to just all fall out at once. It wasn't the normal pattern where you lose your temples and then your crown and the various Norwood scales. It just poof, and it kind of was diffuse and then it was gone. And I think that might be somewhat of a product of my head injury. But since it's been transplanted, and as I was showing you, it's been transplanted in what you might call a typical Norwood fashion. Because it's sunny, and for that reason I'm going to cover my head. But So when you're getting the transplant, even the temples, the vertex, the crown, most people figure that out. They know they need that. And then first of all, if you're getting a transplant and the doctor has a bad technique, they have bad yield, bad angle, too deep, you've already lost from the beginning. And no matter what they do, no matter how many grafts you have, it is not going to look good. But assuming they do have a good technique, then density becomes important. But furthermore, a lot of doctors like to do, and again, this kind of mature hairline. And even a child, when they look at someone, they notice something is different. And people who are not staring at hairlines all day and aren't well versed in it, that's the telltale sign that you look older, you look maybe less healthy. And I hate to say this, but this is just what goes with hair loss. And you really need that youthful hairline. Some people call it squaring off at the temples, and I'll include some pictures. So that's one thing, and I knew that for a while. But one thing I only really realized in recent years is what they call the temple points. And as I discussed in that other clip, there can be recession here too, and a lot of times this temple goes away. And if you look at people like George Clooney or Brad Pitt or all the handsome guys, Tom Cruise, who have the full head of hair, they're always going to not have any recession here. So a lot of times this is a complication, but you need to restore this too. You need the temples. You might need to bring this forward. And you need this, maybe not exactly a straight line, but it needs to go across if you really want to capture that youthful appearance. And I know a lot of people, it's a total transformation, even just getting their hairline. But if you want to look like you have a full head of hair, you've got to restore those temples, you've got to restore the temple points. And that's what I'm going for. Why not? In my next procedure, I want to restore the temple points. I'm going to bring this forward a little bit. And some people, they don't need that. Some people, their natural hair loss, they don't lose that hair. They just lose the temples. Depends on your scale in the Norwood. But for me and for many people with severe hair loss, progressive hair loss, that goes away. So before you even start on this journey, you've got to know how many grafts are available if you want to get to that full restoration. It's not only going to be the top, also going to be the temples, possibly going to be the side, and the crown can be a bottomless pit. So for me, fortunately, I do have a lot of beard hair, I have a lot of body hair, so why not? I'm going for it. I'm going to try to bring it all the way back to basically what it was like when I was a teenager. Some doctors and some people argue, no, you should have the temple recession. That's not a normal hairline. And I would say if you can't get it thick enough, it might look weird if you bring this forward and you don't have that. But I've been able to bring that back, so I'm going all in. I'm gonna bring back that hair too. I still have a lot of leg hair, so George Clooney, Tom Cruise, so these are the people, these are my peer group. I gotta tell you, I hope you guys know I was joking when I said I'm in the same league with George Clooney, Brad Pitt, Tom Cruise, those guys. I mean, obviously, they're good looking, they've got class, they've got charisma, but they're not quite in my league, they're not quite in my level. They try really hard, but it's just a natural ability, a natural good look. So, I like those guys, but we all know they're not quite at my level. As there's only one Jay International, and he needs to have a full head of hair, and that's all there is to it. When you saw the Beatles or like some of the haircuts in the 70s, you might have used the term a mop. Like they just looked like they had a mop, a bowl cut. There's thick hair all over. And that was because the style in that time was to have the sides thick as well. But the only way you're going to get that thick, like total mop look, is you also have to have thick sides, and you can't have recession here. So that's why a lot of times guys will get a transplant, they'll restore the top, they slick it back, it looks great. But if you want to have that mop look, which isn't as popular as it used to be, but if you want it,
you would also need to restore the size. So you'd have to get transplanted here, and you probably also would have to take some type of DHT blocker to restore that, for that look of just totally having hair like you've never lost a hair on your head, the hair you were born with. That's what it takes.
I'm going to be rebuilding the temple point here, and I do here. I'd have to recreate it entirely. On this side, it's just a matter of rebuilding the temple point. And I talked about this before, and I've seen some other people do some excellent videos about this topic also. But to really create that look of fullness and to completely frame your face, it's not as simple as just a hairline. You also need this extending out, and that's the complete picture. That's what makes you look like you don't have a strangely shaped head in some cases. That's what it takes. So going through a lot of shot loss right now, and I'm going to be having another surgery, small one, pretty soon in this front area, so I might have even more shock loss, but I expect all that hair will come back and everything will be looking good, and that's just part of the game.